be here today at Seraphim's Pharmacy, and we've met Nick, who is the owner. It's been in his family since his father founded it in 1951. In their window today they have a display about PrEP, and PrEP, pre-exposure prophylaxis, will be listed on the Pharmaceutical Benefit Scheme from the 1st of April. And this is about the moment where Australia can become one of the first countries in the world to eliminate the transmission of HIV. This is about saving lives and protecting lives, but it's also about saying to the rest of the world, if we can do this in Australia, we can not just beat HIV here, but beat it right around the world. This moment was impossible a generation ago, but because of the work of extraordinary researchers such as Professor David Cooper, whom we honour with today's announcement. David Cooper and so many others, such as Professor Andrew Grulich, who's here, who's the head of HIV research, treatment and testing at the Kirby Institute, have given their life's work to addressing, treating and beating HIV. And there could not be a more fitting tribute to David's life, to David's work, as not just one of Australia's, but one of the world's leaders in HIV research and treatment, than the day after his passing, the day after his funeral, to launch a new drug in terms of PrEP, which will offer us the chance to beat HIV transmission and to eliminate HIV transmission here in Australia. From the 1st of April, PrEP will be available for concessional payments at $6.40 and at $39.50 for non-concessional. Otherwise it would be $2,500. At least 32,000 patients a year we expect to benefit. It comes with the very strong message that Nick has in his window, that Professor Darryl O'Donnell from the Australian Federation of AIDS Organisations is emphasising, that my great friend and colleague and advocate and campaigner for PrEP, Trent Zimmerman, is emphasising, that PrEP and safe sex together are the pathway to beating HIV in Australia. We know from Andrew's work that already in the trials they've seen a 30% reduction in transmission of HIV infection. So this is a great moment in Australian medical history. In this pharmacy, at this place, we're at the forefront of global leadership for giving people the opportunity to live their lives HIV-free. I'm delighted to introduce Professor Darryl O'Donnell, and after that Professor Andrew Grulich, and then Trent Zimmerman, who has been one of the great advocates for this listing today.
Well, thank you, Greg. This is such an important day for healthcare in Australia because it gives us a real shot at ending the transmission of HIV on our shores. I'm old enough to remember when HIV and AIDS first arrived in Australia. The tragic deaths, the fear, and at times the irrational hysteria that accompanied the disease. But Australia went on to become an internationally recognised leader in tackling HIV and AIDS infections. And that's in large measure because of the incredible work of our health professionals and researchers, people like Professor David Cooper, who has done so much to support those living with HIV. We're moved through stages, moved from the initial onset of HIV and AIDS in Australia to see it become a disease that was manageable, and today we have that chance to end the transmission of HIV in Australia. That is fantastic news for all Australians, but particularly those vulnerable communities that are most at risk of HIV. And I want to pay credit to Greg and his predecessors, because one of the features of HIV in Australia has been the bipartisan support at the federal and state level, which has seen governments tackle HIV with the degree of effort that has made Australia that international leader. So it is an important day for Australia, and this is a great decision to see PrEP listed on the PBS and become accessible to Australians across our country. Thank you.
Thank you. Happy to take any questions if we start with PrEP and then